Her area of expertise is in cognitive behavior therapy, and she has numerous publications on the same topic. She has co-authored a book on primary care on psychiatric care in primary health. She is also a member of the bioethics unit of the Christian Medical College. Welcome.
Good morning. On occupational health in this hospital, they asked all of us who are working in different areas to identify the specific areas in our hospital which are at high risk for different problems, like areas which are at high risk for biological hazards, chemical hazards, sound. For me, this was very easy because stress is everywhere. There's no particular place in the hospital that's free of it. So it was easy to identify our work area. Pressures at the workplace are undeniably going to happen. They're unavoidable because of the demands of a workplace. We know that stress, to some extent, is normal. And in fact, stress can actually encourage people to perform better, to give them the energy and motivation to face the challenges and rise to different opportunities. However, as with most things in life, too much of it can lead to negative consequences. So when the demands become too challenging for an individual, you see the negative aspects of stress, and the work satisfaction changes to fatigue, exhaustion, and dissatisfaction. It is now very clearly known that occupational stress has a significant relationship to ill health, as well as many other negative consequences, such as absenteeism of the employee, dissatisfaction at work, as well as, very significantly, more errors at the workplace. So actually, what is a really healthy job? What would you consider a good work environment? So a place where the demands of work are well balanced by the abilities or the resources that the employee has is said to be a good work environment. So research has clearly shown that when the demands of the work are not balanced and the person feels they don't have the capability of handling this particular job, or they feel that they have no choice in any matter related to work, they have no control over situations, as well as they feel unsupported, then that is a job which is considered very stressful. So the stress-related problems at work are numerous, very varied, depends on who it is, where the person's working. So there's a wide variety of stressors, which can vary from the workload, the interpersonal relationships at work, whether the person feels that they're being denied opportunities to grow, promotion issues, as well as this balance between balancing home as well as work. The nature of the problem will also vary upon the role of the person. There was a study which looked at nurses and doctors. Among the nurses, understaffing and needle stick injuries were the most stressful, whereas the doctors had dealing with death and dying patients, as well as the threat of litigation seemed to be more stressful. So the group and the nature of the work will also determine what is a particular stress. The benefits of reducing stress at the workplace not only benefits the individual, but also the organization, because it will reduce workplace absenteeism, it'll make people more efficient, and also the workforce will be more stable. So definitely there's a great advantage for organizations who do invest in reducing the stress levels at work. The basic principles of intervention to reduce stress include the implementation of programs that will promote health and well-being, as well as implementing effective strategies to prevent the development of stress. The second, of course, would be identification of the sources and addressing those sources of stress. Any change or any intervention in organizations can be done at two levels. One is at the level of the organization itself, global policy changes, which Dr. Pratap mentioned, as well as individual stress management, where you talk to the individual and help them to manage the stress on an individual basis. So obviously the ideal way of intervening would be a combination of both individual as well as organizational interventions. So how would you intervene at an individual level? The first important thing is making people aware, employees aware that the fact, everybody feels stressed, everybody knows they're stressed, but to educate them and make them aware that there are significant consequences to being stressed all the time. So this information can be given to people in the form of posters, pamphlets, or maybe talks with different groups within the hospital. The other would be identifying groups and giving them some education about basic skills. For example, what would be a good way to manage your time efficiently? What are the strategies when you're working with lots of people? What would be a good way to effectively communicate so that you don't develop interpersonal problems? So again, this kind of help and advice can come from colleagues, it may be from counselors. There are even manuals which are given out at workplaces which will give people tips on how to manage these issues. It is also useful to teach employees how to manage the manifestations of stress, that is raised muscle tension, increased BP, and the things that many organizations now do have are protected times for their employees to practice exercises, meditation, yoga, which are very useful. At the individual organizational interface level, it is the organization should take an effort to make it the environment such that workers feel supported. As was already mentioned, it's very important for workers to feel that they can talk to each other, that there are people who are ready to listen to them. It's also important to provide support to those who are at higher or managerial levels who may actually get into that position but not know how to handle it. So it is the responsibility of the organization to provide this kind of help. Also, the physical and environmental problems should be taken care of, which we'll be hearing about over the rest of the day. All organizations should ideally give an increased access to recreational and sporting activities so that the lifestyle of health can be promoted. It's also very useful to have staff appraisal and reward programs because that will encourage workers and make them feel more motivated to perform. Of course, once the stress does come in, despite all these preventive measures, the most important thing is to identify the problem and try and deal with the source of the problem. This is very complex because it will depend upon the individual and the problem that particular person is facing. So the person will require support, guidance, and maybe some counseling as to how to deal with this problem. Now, counseling can be done by people within the same group of people, colleagues, and supervisors, but if it is something which requires further intervention, then counselors or other professional intervention may be required. As Dr. Pratap has mentioned, redressal processes are very important in every institution. These should be streamlined, and every employee should be aware of this process. So if I want to complain, I should know who to complain. So it's important to have a flow chart which is demonstrating how this is done and putting it up in different parts of the hospital. It's also, as already mentioned, people shouldn't be frightened to complain, so it should be a confidential process. So sometimes it helps to put up posters like this, and then it's a kind of direction to people saying that what do you do first, what's the next step, what's the last step, and what's the phone number you actually call when you're feeling this way. Organizational changes are very useful because you're actually dealing with the problem at the root of the problem. However, because it's also one of the most difficult because you have to have commitment from the management in order to create any organizational changes. But those would include choosing the right person for the right job, making changes if you find that the person is not actually able to cope with that particular job, having clear job descriptions and job roles, having an environment where there's communication and more transparent systems, also where employees feel that they're participating in the various programs. It's also important to have family-friendly policies, like we have now started of people having flexible work timings. Those kind of things will make employees feel that the organization is being more supportive to them. So to conclude today, more than probably ever before, the pressures of the workplace are a big threat to the health of the person and in turn to the health of the organization. So it's really important for any organization to invest in helping their employees feel more a part of the institution, helping them to prevent stress as well as to deal with occupational stress when it does arise. Thank you.
Thank you, Anju.
Protocols in place in CMC, which tell people how to outline this. Thank you.
Actually, we are starting this process off, so our plan is to make manuals and also make it available on the intranet so that people can actually see all these particular strategies which can be used. During the Occupational Health Day, we had some programs where people actually came and talked about these issues. There's also a plan to have lay counselors available so that people will be able to access them on the phone, call them when they need, so that people can get help from lay counselors without having to come to psychiatry, because most of these problems are day-to-day issues which do not require professional intervention. They are very normal issues which can be helped with regular counseling.
Thank you. Just one other thing. Usually all these attempts are taken by or used by people who are lower down in the pecking order, so to speak. Is there any way in which the leaders in all these departments are also sensitized to these issues? How would you deal with that?
What we hope is that we would be able to speak to different groups of people and make this make the awareness better so that people be more accepting of this from all levels, because every group of people does need help at some point in time.
Thank you, Anju, and thank you, Pratap, for those wonderful talks. Obviously, the challenge for us is no small challenge. We really have to change the culture of organizations.
Case Jacob and Anurus. Now I would request the speakers to come forward, Dr. Pratap and Dr. Anju. I would request Dr. David Ko to come and give away the mementos for them. Things.